So we need to know what it is that we're getting into. So we'll look at a day in the life of an EMS provider. Now, the objectives of this presentation, at the end, you should be able to define what is an EMS system. You should be able to list the providers that function within an EMS system. You should have an understanding of the type of care provided by EMS providers. You will be able to understand what a typical day is like at work for an EMS provider, and you will know what are the challenges of working in EMS in Jamaica. And we're going to start off with a story. So the shift is 7 p.m. to 7 a.m. So most EMS shifts are 12-hour shifts, some are 24 hours. In Jamaica, within the fire brigade, it's 8-hour shift, and in the occupational health or industrial setting, it's 8-hour shifts as well. I got to work 30 minutes prior to the shift starting, so we need to reach before the shift begins. So time management is extremely important. This is necessary for us to check our equipment, check the unit, check our medications, and ensure that we have everything that we need to respond effectively to emergencies. So you check the ambulance, which is sometimes referred to as the rig or the box. I prayed that the EMS gods would have mercy on us. If the EMS gods had mercy on us, then we wouldn't get a lot of calls for that particular shift. If there was no mercy on us, then we're going to get a lot of calls. The first call comes in at 7:05 p.m. That's the first call. It's a 62-year-old female found unconscious or unresponsive by her husband. So we drive out, lights and sirens, ensuring that we do so with regard for public safety. We arrive on location safely and within 10 minutes. Our scene and patient assessment reveal a diabetic with low blood sugar and bad veins. So this is an unresponsive elderly patient who is diabetic, and she doesn't have good veins and she's unresponsive. This is something I am concerned about, because the particular treatment that would be most beneficial for the patient would be to access the veins and administer glucose or sugar through the veins, but she has bad veins. So this is concerning. But I then remembered I'm a well-trained paramedic, so I ensure that the patient has an airway, there is chest movement, and the heart is pumping. I decided to give a glucagon, which is a medication that is given intramuscular, can be given other routes, but I gave it via the buttocks muscle to buy some time to search for a vein. Now, glucagon, when glucagon is administered, it is converted. Glucagon converts glycogen, which is stored in the liver, to glucose. Eventually, I was able to find a vein, but when I started to insert the IV catheter for this particular patient, I hit a valve. Now, this was the only vein I could find at the time, so I had to find a way to access this vein. So what I ended up doing for this particular patient was I used a syringe with saline solution or normal saline solution, same as salt water. And I attach it to the IV catheter that was still in the vein, touching the valve, and then I use the fluid from the syringe to open the valve and guide the IV catheter into the vein. I was able to establish an IV access, and I was able to give this patient dextrose or sugar through her vein. Within 3 to 5 minutes, the patient woke up or started to regain consciousness. Patient transportation. We then packaged the patient for transport, took her to the most appropriate healthcare facility, and handed her over in a stable condition. That was my first medical patient as a paramedic. I took the lead and I managed well. Now I clean my unit and restock, and I say to myself, bring on the calls. I am ready. So once a call has ended, we need to clean up the back of the unit, fix up, replace anything that has been used, and prepare for another dispatch. The conclusion. I had 6 more emergency calls on that particular shift. Some did not end perfectly, but we learned to do and hope for the best by being disciplined and following protocols. So as EMS responders, we don't operate independently. We're guided by protocols, and these protocols can be offline or they can be online. So we're under what is referred to as medical direction. And a medical director is a ER physician with training in EMS or emergency medical services. The online protocol or online direction would be if I have an issue in the field that exceeds written orders, I can call the medical director directly and get advice. Standing orders or protocols that are written are referred to as offline. And an example of that would be, for this particular patient, the patient was found unresponsive, blood sugar is low. The standing order is you establish IV access and give dextrose. If IV access is not accessible, you give glucagon. So that is a standing order. I don't need to call the medical director directly to get permission to do that. Now, I'll talk about that at the end. Some people think we just do first aid. Others think we operate a taxi service, especially in Jamaica. Some think we are race car drivers, and others think what we do makes us heroes. What we really do is provide emergency care to the sick and injured in the field. So what is an EMS system? An EMS system, or emergency medical services system, is much more than a ride to the hospital. It is a system of coordinated response and emergency medical care involving multiple people and agencies. These agencies are the hospitals. So we have EMS responders that work in the hospitals. We have EMS responders that work in the police force. We have EMS responders that work in the fire service, the JDF, private ambulance services in Jamaica, and we have EMS responders in industrial setting. The response within an EMS system can either be BLS or basic life support, and there is a confusion around that. A lot of persons tend to believe that BLS is specific to CPR. As it relates to EMS, it's much more than that. So that's basic life support. ALS is advanced life support services. So that's in a nutshell what an EMS system is. Now, within an EMS system, there are EMS responders, and there are 4 levels of responders that are based on the curriculum. 4 levels of responders that are recognized. You have EMRs, which is the level that all of you will be trained at. Emergency medical responders. EMRs provide field care prior to ambulance arrival. So an EMR is the first medically trained person to arrive on the scene and interact with the patient. Now, the EMR functions primarily outside of the ambulance. This is very important. So an EMR functions primarily outside of the ambulance. This is firefighters, police officers, safety officers, specific personnel within industrial companies. So what it means is an EMR should not be in charge of a patient in the back of an ambulance. If an EMR is in the back of an ambulance, they are present to assist either EMT, AEMT, or paramedic. But no EMR should be in the back of a unit, and they are fully responsible for any patient. Very important. So their function is outside of the unit. And I will repeat, I'm almost certain this is an exam question. The EMR is the first medically trained personnel to arrive on the scene and interact with the patient. They are able to provide life-sustaining care to a patient that is injured or a patient that is ill until EMS, BLS, or ALS response via ambulance is available. When the ambulance arrives, the EMR will hand over to either EMT, AEMT, or paramedic. And the EMT, AEMT, or paramedic can request the EMR to travel with the patient in the back of the unit to assist in the care. But the EMR should not have sole responsibility over the patient. So that's the EMR level. Now, the next level of EMS provider is the EMTs, or emergency medical technicians. They are trained to provide field emergency medical care and continuous care during transport on an ambulance. So an EMT can function outside of the ambulance, and the EMT can function within the ambulance. And it's basic life support. So it's interventions to maintain a patient's airway, ventilation, control bleeding, treat for shock, manage a patient with spinal injury, use an AED during CPR if required, provide certain medical assessment and treatment as required for patients in medical emergencies. That's an EMT. Now, within Jamaica, majority of the responders in Jamaica are EMTs. And this is considered the foundation level of EMS response as it relates to ambulance transportation. So it's a fundamental level. What that means is it doesn't matter how far we go beyond the EMT level, the foundation care will start there as it relates to ambulance transportation. Now, the next level of EMS providers is the AEMTs. or advanced emergency medical technicians. They are trained to provide certain level of advanced emergency care in the field and during ambulance transportation. So they can use certain advanced airway equipments. They can do IV access or intravenous access. They can do intraosseous access. They can give certain medications. And they can do advanced assessment. Don't have a lot of AEMTs in Jamaica. Majority of the AEMTs that I've trained are most are either within the fire brigade or they have migrated to better opportunities. So they have left the island for better opportunities. So that's AEMTs. Now the fourth level, or number 4 for the EMS providers, is the paramedics. Paramedics are trained to provide all aspects of advanced emergency care in the field and during ambulance transport. So a paramedic covers extensive training, extensive advanced life support. They can give emergency medication, they can do dynamic and static cardiology or cardiac monitoring. They can give a wide range of drugs or medication. They can perform certain invasive procedures, surgical airway, chest decompression, thoracotomy, opening the chest. So these are paramedics. Now, there's not a lot of paramedics in Jamaica. And the truth is, there is only 2 paramedics in Jamaica currently. One is within the JFB, or Jamaica Fire Brigade. He's the superintendent for EMS, and the other paramedic is me. So there's 2 legitimate paramedics currently in the island. Now, the most common level of EMS providers in Jamaica are EMTs. EMTs primarily function on a BLS unit. AEMTs and paramedics work on an ALS unit. And again, BLS is basic life support. ALS is advanced life support. Now, the emergency care that we deliver as EMS providers. The level of care provided includes, but it is not limited to. So we cover airway management, bleeding and shock management, splinting, spinal motion restrictions, medication administration, field management of a critical trauma and medical patient. Now, hold on. A typical day at work for an EMS provider will involve time management. I've mentioned that before. Time management is essential in EMS. You have to be able to manage your time well. And that means turning up at least half an hour before the shift begins or 15 minutes prior to. Waiting and preparation. So once we turn up for work, we have to ensure that our ambulance is functional. All the equipment that is required is on the ambulance, all the medication or documentation stuff is also present. Radio is working good, all of that. You have to do your checks. And after we prepare, then we wait. We wait until a call comes in. And some days it might be slow, it might just be one call. Other days it might be a lot. Calls come in back to back. So once the calls come in, we respond. No, we don't get serious emergencies on every call, despite what you may see on TV. So we don't get a lot of serious emergencies, but when they do occur, we need to be ready. Now, once we respond to an emergency, it is our duty to assess that patient, manage life threats, stabilize the patient as best as possible, package that patient, and transport the patient to the most appropriate facility. And it don't mean drive like crazy. So speed will not save anybody. Speed does not save anyone. Good care does. So most appropriate, and the most appropriate might not necessarily be the nearest facility. So keep that in mind. Now, once we arrive at the most appropriate healthcare facility, based on the nature of the call, we will hand over the patient. So we give a verbal report, hand over the patient, and the medical staff will sign or report. Now, when you're handing over a patient, you cannot hand over a patient to someone who is below your level of training. That would be a breach of the standard of care. So the person must be at your level or higher. And do not hand over a patient until you have given your report and your report is understood. Now, after you've handed over the patient, it is our responsibility to clean up the unit. And as I stated previously, we need to restock and prepare for the next call. Now, challenges in EMS in Jamaica. Poor public awareness and education. So that's a major issue in Jamaica. The average Jamaican don't know who an EMT is and the role of EMS responders. A lot of people think that they are just ambulance drivers in Jamaica. You mentioned the word EMT to the average Jamaican, they have no clue what you're talking about. You mentioned the term EMS, no idea what you're talking about. So there's an issue with public awareness. And I don't even want to say this on while I'm being recorded, but we can have this conversation in person. And it is the responsibility of the government, it is the responsibility of the EMS providers who are currently working in the field to ensure that the public is aware and educated as it relates to our role when we respond to provide care. Because when the public don't know what you're doing, it's going to be a rough day for you. It's going to be a very rough day. Because when you're spending time to make sure you don't move a patient to compromise their spine, or you don't move a patient before stabilizing their airway, John Public is going to say, what you do? You waste time. Take up the money and go on where you're gonna. Yeah, doctor, ray. All of that nonsense. So the less the public knows about your role, the harder your job is gonna be when you're out there. There is a lack of proper government regulations and clearly defined scope of practice. So within EMS, there is something that is referred to as the scope of practice, and there is something that is referred to as the standard of care. Now, the standard of care is how you perform a particular task at your level. What does that mean? So if I train you as an EMR to position a patient's airway, assess and put in a oral pharyngeal airway or airway adjunct, anywhere you go in the world and meet another EMR is the same way they will do it. There should be no difference. That's the standard of care. So it's right across the board. The scope of practice is the skills that you are allowed to do at your level. So the standard of care is how you execute the skill. The scope of practice is the skills that you are allowed to perform at your level. So I train you as an EMR, and you go out there and decide that you're gonna establish IV access and give fluids to a patient. If you do that, you're going beyond your scope of practice, because IV access is not a part of EMR training. So that's scope of practice. Now, the medical director is responsible for determining how much of your scope you are allowed to execute. So the medical director can limit your scope of practice, or the medical director can allow you to perform all the skills within your scope of practice, but your medical director cannot give you a skill to practice outside of your scope. So that's scope of practice and standard of care. And we are extending, somebody's mic is open. We are extensions of the medical director's arm in the field. So we're functioning on the license of a medical director. We do not operate independently. Remember that. Now, and the government is responsible for deciding what the scope of practice is going to be for each level. Now, there is no regulated ALS service to utilize AEMTs and paramedics. So we don't have a regulated ALS response system. And there are calls that the basic stuff will not be sufficient, where ALS interventions are necessary. There is underutilization and appreciation due to the length of time EMS providers are trained for. So that's an issue. EMRs can complete their training in 1 to 2 weeks. EMTs can complete their training, or emergency medical technicians can complete their training within 9 weeks, 10 weeks to 3 months. AEMTs can complete their training within 3 months to 6 months. Paramedics can complete their training within 9 months, a year, 2 years, 3 years, or 4 years, depending on the type of program. But there are concerns about the length of time. There is no data to support that the length of time is going to cause problems, but there are concerns. In summary, EMS is essential to pre-hospital field care. So EMS is essential. Your role as an EMR is very important. So your role as an EMR is no less important than the role of an EMT, AEMT, or paramedic, because we're building. There's a chain, and that's the link to survival. So if there is no EMR to establish field care, when the EMT comes, the EMT will have to do what an EMR would have done, then do what they need to do as an EMT. If there is no EMT response, then when the patient get to the hospital, the doctors and nurses will have to do what an EMT would have done in the field before they can do what is necessary for the patient. So when there is when there's a response absent in the chain link for survival. It greatly affects the patient's level of care and the patient's prognosis. So it's very important, and there should be no comparison. So there is no comparison between an EMS responder and a nurse. There is no comparison between an EMS responder and a doctor. A nurse and a doctor function inside of an hospital. They do definitive care. EMS responders function outside of the hospital. We do pre-hospital care. Neither is more important. Both are necessary. That's the mindset we need to have. A day in the life of an EMS provider is very dynamic and long, but it can be very exciting and memorable. There are major challenges that exist in EMS in Jamaica. And we will see if over the years to come, if some of these challenges will be addressed. And that would be the end of this particular lecture.